We are answering your questions about the coronavirus with Cone Health's Chief Operating Officer, Dr. Mary Jo Cagle. Remember, you can text your questions to 336-379-5775. Let's talk about recovery rates and death rates, because we have seen that, like Guilford County, for instance, the death rate in Guilford County seems to be elevated, more elevated than in other places in the state. So can you give us some context on that?
Sure. So when we look across the United States and in most places in the world, the mortality rate looks to be about 2.5%. And that's about what North Carolina looks to be. When you look at Guilford County, it does seem higher until you really dig into the numbers. In Guilford County, the majority of tests to identify cases have been on hospitalized patients. So you have to look at what your numerator, if we're going to look at death rates, the number of people who have died is, but you also have to look at the denominator, the number of tests to identify cases has been. But we know that Guilford County has tested much fewer people than compared to other counties, many other counties in North Carolina. So for instance, if you compared us here, we've done somewhere in the neighborhood of 2,500 to 3,000 cases of tests. Compare that, for instance, to Mecklenburg County, where there have been over 20,000 tests done. They've had the ability to test much more broadly, not just hospitalized patients, but their health department has had the ability to also test much more broadly. So when you test more broadly, you identify not just the sick patients that get hospitalized, but you're able to identify mild cases of patients who are treated at home as well. So therefore, you're looking more broadly at all kinds of cases, maybe even asymptomatic cases. And so therefore, the death rate will look lower there because you're identifying not just the very sickest of cases who are hospitalized, but milder cases.
And so to change those numbers, we would have to do more tests. And to do that, what would have to happen to get more tests to be able to do that?
So that's the phase we're moving into now. We have begun now just this weekend to test all patients admitted to the hospital, not just those that were admitted with a diagnosis, a respiratory diagnosis suspicious for COVID. And the health department that we're partnering with has begun to do community testing. So with the wider based testing, we'll begin to have a better idea of how widespread the disease is. We'll be able to identify more cases. And I think we'll get a more realistic idea of what the true death rate is and has been in Guilford County.
Someone is asking, how can I protect myself when fewer and fewer people are wearing masks?
I'm sorry, I didn't understand that.
How can I protect myself when fewer and fewer people are wearing masks?
So I believe that's when we have to make really wise decisions about when we're going to leave home, where we're going to go, and when we're out in public, staying that 6 feet distance away, and making sure that do we have wipes where we can clean things, that if you're in the grocery store, cleaning that buggy, and really keeping that 6 feet distance between you and another person, especially if they're not wearing masks.
All right, someone is saying, my 31-year-old son has a fever. Does that mean he should go and get tested?
I do think if someone has symptoms, you can use our virtual visit and call or use a video visit first for screening. So those screenings can be done free, actually, to determine what the next steps are, and then they'll guide your son to determine where to go for testing and further evaluation.
And that's on the Cone Health website for the virtual site for the virtual visits. And so we'll make sure that it's in our web story that we'll be posting, so that you at home will be able to have that link and have it very easily. So someone asked, what are your thoughts on wearing face shields versus wearing face masks?
So I think the face mask is perfectly fine. Really, even in the hospital for our employees, the only time we're wearing face shields is in surgery or in the ICU caring for our coronavirus patients.
Someone is asking, is it safe to wear contacts and safe to change them? I know we're not supposed to touch our face.
So I personally have gone to wearing my glasses instead of my contact lenses during this time to help me break the habit of touching my face. There's nothing wrong with wearing your contact lenses if you can break the habit of touching your eyes during the day. Most of us who wear contact lenses are really great about washing our hands with soap and water before we insert and remove our contact lenses. It's in between those times that we have to break the habit of reaching up and touching our faces during the day.
Last question, and very quickly here, someone just texted, do we still have to wash our hands for 20 seconds?
Yes, absolutely. In fact, we should have been doing that before coronavirus. It's just taught us this great new habit that we should be using all the time.
Yes, because it is the 20 seconds. That's the time that it takes for the water and the soap to latch on to the virus. And then as the back and forth is going, for it to actually fall off.
Right. And in between our fingers and around our fingernails.
Because that's where you're eating and then touching and all of the other things. Okay, thank you so much, Dr. Cagle. We so appreciate it. And of course, we will have those links for you in the web story there on WFNYnews2.com.